we will go ahead and get started here. Let me go ahead and share my screen with all of you. Okay, so welcome to building a telehealth infrastructure for your practice during a time of crisis. My name is Erin Molyneaux Baily. I am the Chief Operating Officer of Cognitive Behavior Institute, and I have been with CBI for the last 5 years. I've been in client service for about the last 15 years. When Kevin Caradad and I started CBI, it was him and one other therapist, and we've now grown our practice to 3 physical locations and over 50 clinicians. And while we've experienced a lot within that growth, this is definitely our first pandemic, but what we have learned over the years, and we have been doing telehealth for several years, but what we have learned, over these past couple years, some of it can be applicable to building telehealth within your practice now. So we wanted to share this information with our colleagues and anybody else who finds this helpful, because this is just an unprecedented time. And I kind of wanted to start by saying to everybody who is on this today, if nobody has told you this yet today, you are all doing an amazing job. Not only do you carry the burden of, alleviating human suffering for your clients, but to also be thrown into the, throes of completely transforming how you deliver that care, basically almost overnight. I feel like, a lot has changed since when we all left work on Friday to where we are today, and that kind of began on Monday. So if anybody hasn't told you that today, you're doing an amazing job. There's no kind of right or wrong way to do this. We're all finding our way, but we definitely wanted to take some time today to put something together that could be helpful for you guys. So we appreciate you being here with us. So I first, hang on one second. Okay, so first, just a little disclaimer. This information is educational purposes only. None of this is practice specific to your specific practice, because we don't know enough about your specific practice. If consulting is something you are interested in, we do that on the side, but that is not what today's purpose is for. This is for educational purposes, for us to share with you what we know so far, what we've learned, and some helpful strategies. So the topics that we are going to talk about today revolve around communication, logistics, and billing. And these are 3 things that I think are critical to your infrastructure, and things that we're going to kind of go through today and address. So the first one we're going to start with is communication to clients. So getting information out to your clients as soon as possible is the best thing you can do, given the situation that we are in. So that can happen a couple different ways. One thing that is a great suggestion is if you have a phone greeting on, whether it's your Google Voice or your cell phone, or your practice has a phone and you have a complex phone system, changing your greeting to let your clients know what your plan is. So your plan to switch from all in-person appointments to virtual, so that you do not disrupt their continuity of care. Getting that message on your phone line is going to be critical, because what's probably happening is people are calling you faster than you can call your clients. And getting that information out there is going to put people a little bit more at ease, given the situation, hearing about all these places closing, and just that uncertainty that everyone is sitting with. If you're able to do a mass email notification, that's also something that's a really good idea. If you have an electronic health record, you probably can export a file of all your client email addresses so that you can send out a mass email notification. I know that that's something that we did. We were able to reach, 5,000 people at one time. We were putting in information in there as to what physical office locations were closed, what ones were remaining open. This was, again, a couple days ago before things got to the dire circumstances that they are now. And then letting people know to who to contact, what number to contact, where they could email us, those kind of things, just getting out as much information as to what the plan is for your client's continuity of care is going to be very helpful. So another thing that is really important is putting signage at your physical location, if you can still get there, so that anybody who you may not have been successful in reaching is able to, when they go there, see that who they can contact and so that they can get their appointment converted from in-person to virtual. And when it comes to communicating to your clients, delivery is truly everything. We have found that when calling our clients to inform them the change of the virtual appointments, over 95% of our clients have converted to virtual when we use language that was direct, simple, and comforting. So I don't want to say that we weren't giving people a choice to do virtual, but when we were calling them, we were not asking them if they wanted to do virtual or if that was okay with them. We were calling and we were telling them that we were converting their appointment from in-person to virtual as to continue their care. And we were using language that resonated with people who are typically very anxious during this time. We were saying things like, we have a simple and easy application for you to use. It's very similar to FaceTime. That's something that was a phrase of familiarity because a lot of people are familiar with FaceTime. And we were using that when we were describing our platform, which we currently use Zoom, but we were using that to explain the process of you're going to click on a link in your email and it's going to pop up like FaceTime. And we found that people not only appreciated the fact that they could do virtual during this time when everyone is, kind of on lockdown, but we found that they were so surprised at how simple it was and how much better they felt to know that at this time when we were introducing something new to them and they were already anxious, that it wasn't going to be something complicated. So no matter what platform you are using, I would suggest that you're using words like simple and easy, equating it to something they're familiar with, such as FaceTime, and explaining to them, they're going to click on a link or download an app or something that is easy. What we've also done in our emails to the clients, because we have to email them a Zoom link to their appointment, is we have provided hard copy directions so that they actually have a step-by-step guide for Zoom in order to log on. And we've shared this on our CBI Center for Education Facebook page. If anybody out there uses Zoom, the free version of Zoom is not HIPAA compliant, but if you do purchase the healthcare version, which comes with the BAA, that is HIPAA compliant. And so for anybody out there using Zoom, you can head on over to our CBI Center for Education Facebook page. I did upload a document to there. It is a publicly shared Google Sheet, which anyone can save to their computer. And we are emailing this to our clients so that they actually have instructions more than just the verbal instructions that we are providing over the phone. So people have also appreciated that. From a logistical standpoint, I kind of split this slide into things that are kind of must-haves for doing telehealth and things that are nice to have. So from a must-have standpoint, the HIPAA compliant platform. Now I know that some insurances such as Medicare have loosened the requirements for HIPAA compliant platforms. I have this in there because that is best practice, although insurance specific is kind of mandating as to what can and cannot be used. But just generally speaking, a HIPAA compliant platform is definitely a must have. So I know there's a lot of great ones out there that are free, some that you pay for. I know some of the ones that are free, I may have heard that some of them people were having technical difficulties. If anybody out there is named Caroline, if you could mute your audio, please. Okay, perfect. Thank you so much. We just have everybody in their house, so anybody joining us, if you could just make sure you're muted, that is very appreciated. Thank you. Okay. Caroline, if you can mute yourself again.
Okay.
Thank you so much. Okay, great. So the HIPAA compliant platform, there are several out there that you can pay for or that are free. And also something that's a must-have for you to do telehealth is a secure and private space. So I know everybody is at home with their kids and their pets and everything else going on. The goal would be to be in a secure and private space, just like your office setting typically. Obviously due to sound, confidentiality, all those concerns that we normally deal with on a daily basis. Something else that is a must-have is an online consent for treatment if you are going to be seeing any new clients during this time. So we are still scheduling new clients. We still have new client intakes that were already on the books for this week and for the next several weeks. When it comes to consent for treatment, if you are currently using paper only, what you can do is there's several different options. So some of the ideas that I was thinking of is you can email a general form to your client and have them printed and make sure they mail it to you. If you are going to be still, receiving mail, so to speak, and the appointment is, several days away. Another option is you can use some good programs such as Adobe EchoSign, which is HIPAA compliant. There's a version of HIPAA compliant Adobe EchoSign that you can email to. You can upload your template and email it over to the client. They can sign electronically, which is valid. You can sign electronically also, and then you can upload it to their chart. If you don't have a lot of cloud-based usage of your practice right now, like if you're not using an EHR and you're not using online consent, this is kind of an awesome time to build those things into your practice. I know it's not ideal to kind of just throw yourself into that, but getting those things set up are definitely going to make your life easier when it comes to, doing this for however long we may be doing this, which none of us are really sure, how long the social distancing is really going to be necessary given the spread of the disease. So some other real must-haves are telehealth policies. And if you haven't been doing telehealth, you probably don't have these. At our practice, we have been doing telehealth for several years, so we do have these distance counseling procedures on our website. And I've included the link to our website, which is the papsychotherapy.org. If you click on forms and then informed consent for behavioral health treatment, and then distance counseling procedures. Feel free to poach our distance counseling procedures off of our website. We are here to share during this time. And in those, you are going to find some information that we provide to our patients as far as the pros and cons of telehealth, as far as some boundaries and also some other information and expectations that we have from our clients when they are wanting or agreeing to do telehealth. So that is available on our website, and dispersing those to your clients ahead of time is definitely a good idea so that they can know what to expect. I've also included some nice to haves during this time, and for everyone out there, whether you are a single clinician in your own practice, or you are running a practice or a program or a clinic of hundreds of people, it's really nice to have the administrative support in order so that if you are actually seeing clients and you're not able to keep up with the phone calls that are coming in or reaching out proactively to your clients before they contact you, it's really nice to have that administrative support. And I know that might not be possible for everyone, but I do know that there are a lot of people out there right now who, maybe are worked in a different industry and got laid off, maybe looking for some extra hours, whether that also could be an intern. And I just wanted to briefly touch base on interns, even though I don't have that on here, but we have worked with a lot of bachelor's level interns who are seniors completing their last semester of college, and they could be psychology majors, they could be social work majors at the bachelor's level, they could be marketing majors, business majors. We have really found that there are a lot of great college seniors out there who are interested in learning about private practice. They may want to be a psychologist one day, a social worker, a counselor, and they are eager to learn as to what it takes to make a private practice happen. And those are the things that they don't teach you from what I've heard in grad school. And so we have utilized a lot of really excellent interns who, come, they get credits from their school. They come, 20 hours a week, and they're giving you great administrative support. They're helping you on all sorts of fronts. They're learning about, what it takes to run a private practice. We've actually hired some of these interns to be full-time for our administrative team. So I just kind of wanted to share that tip for everyone out there. And the best part about it is you don't have to pay them additional funds because they are getting class credits, and it really has been a blessing, and it's worked out really well. I've actually reached out to one or two of them who have come back and are also working remotely with us during this time to offer extra administrative support, just because of the large call volume and everything that's going on currently. So if you've never had an intern before, I would definitely suggest to look into it if it's something that's possible. If you have any local universities near you for the bachelor's level, it's definitely something you might want to check out. So another nice to have is an electronic health record and billing system. This allows you to do things like accept payments online, be able to export your patient lists so that people, you can call or do mass emails, sort by insurances for clients so that you know who has what, so that when it comes to informing your client, as to what the current coverage is or what's going on with the insurances and what platforms you're allowed to use and what's covered and what's not, that's really nice too. If you don't have an EHR, which I know some people don't, you'll want to come up with some sort of payment acceptance method over the next several weeks. If you are usually getting cash or check, that is something that could be an issue here in the next couple weeks. Whether you want them to continue to mail the check to an address that you will be getting, or if you're going to be using some sort of credit card online payment acceptance method, you'll want to get a good sense of how you're going to accept money for any copays or deductibles during this time. And then lastly, a cloud-based phone and fax system. If you're typically using that for when it comes to clients calling in and you have different lines, whether they're pushing, different options, if they have medication refills for psychiatry, or if you are, putting new patients to one line and current patients to another, having a cloud-based phone system also is nice because you're able to route people to the direct lines that they need. And then if anyone is specifically calling regarding telehealth or needing immediate assistance or technical support or anything of that nature, you can have, a separate line for them to push and then someone to answer that obviously as soon as possible. So those are some of the nice to haves to touch base on. So next we're going to dive into the insurance and the billing. And this is kind of a very fluid situation. I know a lot of information is coming out on the daily. And so these slides I put together basically for what we know right now. And the first one is Medicare. So we know that President Trump came on television and told everyone that they can continue to see their doctors and continue to, that their care would not be interrupted. We do know that Medicare is allowing telehealth via even a non-compliant means, such as FaceTime. We also know that they are allowing telephonic sessions for virtual care for clients who do not have access to technology. So we do know, obviously HIPAA compliant is best practice, but we do know that the government is waiving those requirements, and they are allowing those clients to do telephone and non-HIPAA compliant means of communication, such as FaceTime, in order for continuity of care. We do know with regards to billing Medicare that we are to bill with a GT modifier, and that the place of service is to be 02, which is for telehealth. The next slide I have is regarding Pennsylvania Medicaid. This one is very fluid at the moment because it is my understanding that each county is kind of working as to the billing piece. However, we do know that from Governor Wolf's office, they are currently allowing telehealth via telephonic means if the technology is not available to do it versus a software for video. I do not have specific information regarding billing with Medicaid as far as modifiers and places of service and all that, because we personally don't take Medicaid at our practice. However, I have reached out to business managers at other practices that take Medicaid, and they are still weeding through the communication. From what I understand, they're getting different communication on the daily as far as, you know, hang on a second, don't bill, we're not sure yet, or this is how you do it. So I did not include any billing information on Medicaid because it is so county specific at this time, and I do not have, it seems very fluid. That seems the most fluid of all the insurers, I would say, at the moment, but I'm sure further clarification is coming as far as how to bill for those services. Next, for anyone on here that is in Pennsylvania, UPMC. UPMC announced after much persuasion that they are currently covering all commercial and Medicare plans for virtual. So if anybody out there is someone who helped advocate for that, thank you very much. I know that they received a very large amount of phone calls, emails, all that stuff in order to get them to see the light that it is covered, and they sure did, sending out communication that they are currently covering all plans for virtual. They are letting us know to bill with the 95 modifier and the place of service as 02. For Highmark and BlueCross BlueShield, Highmark is the local BCBS network here in Pittsburgh, Pennsylvania, where we're based. They themselves and their policyholders, they are covering all plans for virtual. They are instructing us to bill with the GT modifier and also the 02 place of service for telehealth. When it comes to BlueCross BlueShield state-specific plans, those are still up in the air. I know there's a ton of them, and I know they're hard to get a hold of because you have to call the number on the back of the provider's card. But there has not been clear communication from each BCBS plan, state-specific plans, as to how they're handling that. So at this time, virtual coverage for those plans still vary as far as we can tell, and you are having to contact each insurer individually in order to see if they are honoring the telehealth currently. Aetna did send communication that they are covering all plans for both commercial and Medicare products for virtual. Okay, great. I'm just reading some comments here. Someone had said, I have Highmark Insurance. They said they will cover all telemedicine. I received an email this week. Yes. So Highmark themselves are covering virtual. From what we understand, it's just the state-specific BlueCross BlueShield plans that we were not sure of. Okay, and then someone else replied, oh, Dr. Taryn, Medicaid is allowing telehealth, telephonic. Yes, so we do know that they are allowing telehealth and telephonic. What I was referring to is the billing piece and actually submitting the claims. I had several people say they've been receiving communication from counties directly stating that they are allowing it, but they have not yet sent information on how to bill it. But I am not an expert on Medicaid and I do not claim to be. So that's all I have to share on that. But back to Aetna, so they are covering both commercial and Medicare. And they are asking to bill with the GT modifier and the place of service as 02. Okay, so next is United. United did send communication that they were currently covering all plans, both commercial and Medicare products for virtual. United typically does cover commercial when you are credentialed as a telemental health provider as part of your credentialing process. They've actually waived that, stating that they are no longer requiring that separate piece of credentialing, and that anyone who's credentialed with United is able to submit claims and provide virtual therapy. So for those services, they've also asked to bill with the GT modifier and the place of service as 02 for telehealth. Okay, so next is TRICARE. TRICARE typically always allows for virtual, so there's no changes with them. You also bill with the 95 modifier and the place of service as 02. That is not a change. Cigna is virtual, is still administered. Well, actually, let me back up a little bit. So Cigna is one that sent information yesterday. It was a little bit disappointing because I feel like we've been getting a lot of information that said, hey, we're allowing a blanket coverage for telehealth. Cigna's email yesterday stated that they are still following plan-specific benefits as to whether or not virtual coverage is administered in accordance with a plan's benefit. So they have not yet extended the blanket virtual coverage. That was as of yesterday when we received email directly from them. They are currently waiving the telehealth attestation for providers who are credentialed with them, but may not be credentialed for telehealth. So as long as you're credentialed with Cigna, they are currently waiving the telehealth attestation. And then for plans where virtual coverage is a covered benefit, they are stating to use a HIPAA compliant platform or conduct a telephonic session for clients who do not have access to technology to participate in virtual appointments. So while they're not giving blanket coverage, they are extending that telephonic session. Unlike some of the other insurances, they are extending the telephonic session similar to Medicare when it comes to clients who may not have a HIPAA compliant platform. For Cigna, the modifier 95 and the place of service 02 was in the communication that we received yesterday. I also wanted to put Magellan on here because I know some people in Western PA might take that, and we have some people on this webinar from the eastern side of the state. And Magellan sent out some communication today, actually, that you can use a HIPAA compliant platform, you can use FaceTime, you can use telephonic sessions for clients who don't have access to technology. They did give different billing instructions for whether or not you are using something HIPAA compliant or something non-HIPAA compliant. So for Magellan, if it's HIPAA compliant, they're asking you to use 95 or GT with 02 as the place of service. If it's a non-HIPAA compliant platform, such as FaceTime that they're allowing, or a phone session, they are asking that you use GQ as the modifier. And this is the first time that I have ever seen GQ, so this is not a typo. GQ is what they put in their communication for non-HIPAA compliant or phone sessions for Magellan clients. Again, the place of service would be 02. And then they also shared with us that they are currently waiving the typically required telehealth attestation form that is the separate piece of normal credentialing. So that is really good news. So I also wanted to include some tips for clients who may be new to telehealth so that you could share these with your clients. One great suggestion is to log into the platform 10 minutes early. This allows extra time for any technical difficulties. So we know that therapists are famous for scheduling sessions back to back to back to back. And when you communicate to your clients that they should log in 10 minutes early, what that does is that allows for any time for any technical difficulties. So someone goes to start the session on the iPad and then the iPad dies and now they have to look for the charger and then they have to wait for it to turn on. So those are all things that take time and minutes, and we know that that can add up. So we've been suggesting to clients that they log into the platform 10 minutes early, give themselves a little extra cushion. You want to make sure that your client knows to be in a secure, private, and quiet space. We also, it's definitely something that if it's something that isn't possible right now because kids are home or, you have lots of people in your house, those are just all things to consider as far as a client. But we've even been suggesting if people are able to do it in their car or somewhere where you're isolated. So those are other good ideas. Not that a lot of people are out in public right now, but you definitely, if you're going to continue doing telehealth even after the social distancing is over, you definitely want to make sure that your clients know that they can never be in like a public setting and open their phone to start a session and they're sitting in the middle of a park with lots of people around, just that it needs to be secure and private and confidential. If you're going to be changing any of your payment methods during this time, when that comes to cash or check, you'll definitely want to communicate that to your clients so they can be prepared to plan accordingly. If you're able to take credit cards and you were able to take credit cards before, then that should probably not change. But if you are thinking of some other different payment structure or method that you typically would have, this would be a great time to share it with your client before the appointment so they can plan accordingly. Another idea is to use headphones to reduce the likelihood of anyone else eavesdropping and to cut down on background noise. So that's also really helpful. And also one other thing is to establish a code word. If your client feels like the session has been compromised and suddenly they cannot speak freely. So that's a great way that they can communicate to you if suddenly they feel like the session has been compromised. Here on our next slide, these are helpful tips for clinicians who are new to telehealth. And my first one here is to confirm with your professional liability company that your current coverage does include the ability to provide care virtually. So I know that when we were shopping our policy several years ago, telehealth and providing virtual care was a covered benefit at the time. However, I know that with other policies I was shopping, it was a rider on the plan and there was an extra cost on certain other plans with other companies. So while it could be typically covered, it's definitely worth it to make a quick phone call or shoot a quick email to your professional liability company so that you can confirm that your coverage does in fact cover telehealth. You do want to make sure that you are using a HIPAA compliant software. I know that some of these restrictions are lax when it comes to telephonic or even FaceTime, since certain insurances and Medicare are allowing that. But typically, the standard of care and best practice would be to use a HIPAA compliant software. Another tip is to obtain the physical address of your client at the beginning of the session so that if there are any safety concerns, you have that information of where your client is physically located in the case of an emergency. Another thing that is a good reason to have the physical location is currently it's our understanding that a lot of the reciprocity requirements for practicing or seeing your clients in other states are being waived. But typically the laws of Pennsylvania are mostly that your client needs to be within the state of PA and that you can only provide care in the state in which you are licensed. I know some other states outside of Pennsylvania may accept Pennsylvania therapists into their state, but those are typically the guidelines that we work through. And I know right now that's not really as much of an issue because they are waiving those restrictions, because you've got kids that are suddenly going back home from college and didn't have time to set up care with another provider. And, people who live in Ohio and you typically get care in Pennsylvania, but now they can't leave their house. So there is lots of situations that is being waived currently, but it is a good idea to get the physical address of your client, typically if you're providing telehealth, so that their location abides by any restrictions with your individual license. And then lastly, and I did follow back up with this previously on a tip to share with your client, but creating a plan for accepting any of your patient payments and then communicating that to them ahead of time. So at this time, I'm going to take a look at the chat feature here to see if anybody has any questions. I think I saw a few of them pop in, and so I'd definitely be more than happy to take a look. Let me do that first before we do that. Okay, so someone says, Cigna told me that 95 is the new modifier and replaces GT. Looks like some advise one or the other, but I heard GT will be phased out. Okay, yeah, that's good information. Cigna had that in their communication yesterday, so that could be. So I think that we'll probably be getting more, confirmation on that coming soon. I would not be surprised to hear that. So thank you for sharing that. Another question is UBH. So UBH is the same as United Behavioral Health. So my slide about United is the same information regarding UBH. Another question, are Cigna and Magellan the only two who are approving telephonic communication currently? As far as I am aware, that is correct, as well as Medicare. Just to clarify, is Pennsylvania is or is not waiving the ability to treat across state lines? So it is our understanding that Pennsylvania is waiving the ability to treat across state lines, and is our understanding that that also was in the Senate bill that they signed, stating to reduce the state restrictions so that more people could have access to their care and not be interrupted. Okay, the next question is EAPs. EAPs vary, but some EAPs have always allowed telephonic. I did not touch on EAPs. We take very few EAPs, so I don't have a lot of information on that. And I don't have a lot of info on EAPs. Another question is for Medicare Advantage plans, UPMC for Life, Security Blue, can you do telephonic? So those plans are UPMC plans. Those are not Medicare. I mean, while they're Medicare products, those plans belong to UPMC. They set the standard for care. So at this time, they have communicated that it has to be done virtually. They have not allowed for telephonic counseling. However, well, I'll leave it at that. So they have not communicated us that you can do telephonic. For BCBS Highmark, if a client has an out-of-state plan that covers TellaDoc, can I do telehealth with them? I do not know anything about TellaDoc. My interpretation of that would not be a very good one because we do not do TellaDoc, so I don't want to step outside and give you any information that I myself have not seen. So unfortunately, that would probably be a question for Highmark. Okay, a couple more questions here. Whoops. Hang on one second. Okay. Let's see here. I was speaking with Zoom, the telehealth compliant version at $200 a month for 10 people, in addition $20 a person. That is correct. That's what we have at CBI. That's a large burden for small businesses. Do you know of any other comparable platforms? I do not have a list. However, I would say that if you search on some of the Facebook groups, I believe that there are some really great threads out there that people have used. I know Doxy is one of them. If anybody else in the chat feature has a good suggestion for another HIPAA compliant version, I can only speak to Zoom. We've had really great success with connectivity, and I know their reviews can be mixed on certain platforms. So I just wanted to share that about Zoom. But I definitely, let's see if anybody replied to that. One second, I'm getting some more messages. Okay, so someone said GoToMeeting is HIPAA compliant and starts at $12 per month per meeting organizer. So thank you, Kelly, for that suggestion. That is, that might be one that might work better for people. Okay, so someone was asking about the waiver of the copays. We did see some information regarding this. I have not seen in writing that UPMC has said that whether they will be reimbursing the client for the copay or whether they will be reimbursing the provider and the practice for the copay. So we are not operating any differently until we are told for sure by the insurance companies that they are going to be sending that payment directly, basically reimbursing claims at full cost. We have not received that information from the insurance companies, so we are not currently operating under that, although we would certainly welcome it if they are able to provide that information to us. So to your point, Paula, that some people are saying it's true, others are saying it's not. I do not have clear situation someone says they told me they would reimburse claims at full cost and gave me a reference number. Okay, well, when you submit that, if they do reimburse it at full cost, definitely let us know. Like I said, we haven't seen that communication yet in writing, so we are operating under the circumstance that is still being worked out. Someone else mentioned that IVPad is a good HIPAA compliant way to receive payment and that it's super easy to set up. So thank you, Patrice, for that comment. And someone else asked, does any insurance providers require special credentialing for teletherapy? So William, the answer to your question is typically yes, there are a few that do require it. And those ones seem to be waiving that requirement and just opening it up to anybody who is already credentialed within their network. Certain providers such as United have a specific form that you have to fill out, same with Magellan. And in my slides, it does say that those insurance providers are waiving that requirement. Let me see what else we got here. Okay, so Taryn shared with us that there was a provider alert on the 16th by CCBH saying that if you render telehealth or telephonic sessions as an alternative to traditional face-to-face, that you can submit the claim to community care using 02 as the place of service. So that is great news for CCBH. Thank you, Taryn, for sharing that. I didn't get specific on the billing for Medicaid, like I said, because I've gotten some conflicting information, but that's great news that CCBH sent out a provider alert regarding that. And what else do we have here? Okay, and DoxyMe, someone suggested. Doxy.me has a way to pay in session right on the screen through Stripe. Very convenient. Right now, they have also a free trial for that upgrade. So Barbara, thank you so much for that information. That's really great. That's Doxy.me. And she says that you can pay through Stripe on the screen with a free trial currently. So those are all great inputs. I think this is so awesome that so many colleagues were all coming together kind of just to share information, as if it's not hard enough to see your clients, just to navigate yourself through this. Someone asked about Magellan. Magellan, are they allowing group telehealth sessions? Magellan didn't send out any communication saying that they're not allowing group telehealth sessions. They say that they are allowing telehealth, so I would think that group would fall into that. It would be a normal procedure code. You're asking me, do you know the procedure code for group telehealth? It should be the regular CPT code, I would imagine, with the 02 as the place of service, and then the modifier that they gave that is on my slide. Oh, someone said 90853 is the group therapy. Thank you, Susan. Okay, so someone asked, Beth, can you repeat who's allowing telehealth? So that would be all through the slides, which I've emailed to everyone. So I am not going to repeat all of that, but you definitely have the slide. Someone asked, what would be the best practice if a new client does not have access to a computer or email for consent? Would you suggest physically mailing consents to sign and waiting for the return consent? Absolutely. I think at this point, that might be your only option. You definitely have to have a consent before moving forward with treatment. So if the client doesn't have a computer or email, that would definitely be whether they want to come pick up the forms, blank forms in a mailbox, or mail them to them. That would definitely be your best course of action before engaging in treatment. All right, I'm just, could they sign online using the apps you gave? So they can sign online using Adobe Echo Sign. It's about $15 a month, but they can sign online using the app. It's actually a website. They can sign online using that app. Yes. Someone else just asked, regarding the telehealth apps, how are you getting the software to be available to clients? Do they need to have a computer, and can it just be used through an app on the phone? So Katie, the good news with that is a lot of these programs are app-based. So Zoom, for example, is on a computer or an app that's free that you download. I believe that's the same with the Doxy.me and some others that people have mentioned. So you definitely don't have to have a computer in order to do telehealth. You can absolutely do it on a smartphone. Does anybody else? Oh, Doxy is a website? Okay. I thought I read somewhere someone could get it on an app, but I could be wrong because I don't use it. I can only speak for Zoom, but Zoom can be used on an app or on the computer. Okay. Any other questions that anybody has? Any timeline to know when the rest of the managed care company is going to allow telehealth for unlicensed staff? I do not know. It is my understanding, well, actually, I haven't heard that that's in the pipeline, so I can't speak to that, unfortunately. Okay. So I just wanted to share that I know this was very administrative focused when it comes to infrastructure. Our CEO, Kevin Caradad, is doing another free webinar. He's going to be doing it next Monday, the 23rd, and that is going to be more focused on actually delivering psychotherapy through telehealth, delivering it virtually. And so if anybody has any interest in signing up for that, it's also free. You can see the link to register for that webinar on our Center for, or CBI Center for Education.com website. You can follow us on Facebook and Instagram. We are trying to post resources daily. Somebody asked about great resources for kids for therapy. We shared on our CBI Center for Education Facebook page, we shared several lists of ideas and articles and links and videos and all kind of great resources. Yesterday, that was yesterday's post. And, so you should check that out. A lot of people said that was super helpful. Paula someone had asked, the client can use Doxy on a smartphone, but it is not an app. The therapist just needs to be using a tablet or computer. Oh, and someone else did mention Simple Practice. That is an EHR with teletherapy. Patrice here is saying it's very easy, sounds similar to Zoom, and the first 30 days are free. So if anybody out there doesn't have an EHR, this is a great time to get one. This sounds like this one, Simple Practice, is good for teletherapy built into it, and it's free for the first 30 days. So everyone has my email because I sent it out to you with the slides and the link. So if there's anything that I didn't touch on or any questions you have, feel free to email me. Thanks again for taking time out of your evening to kind of come together. I think actually the chat feature worked out really well. It sounds like everyone has a lot of good info to share, but we hope that you found this helpful, and feel free to follow us on Facebook and Instagram, and check out our website so that all of our future free webinars and free trainings and tips and everything that we're sharing, you can continue to access also. So have a wonderful night. And someone says, thank you for doing this. Thanks for all the information. You're welcome, guys. Take care. Bye-bye.